What's up, guys? How's it going? Cade Moore with More Muscle. Today we're going to be talking about something super interesting. It's called Anaphylactoid syndrome. So guys, we're going to be talking about this, and it's interesting because it's actually very dangerous. This occurs when there's a pregnancy, and basically the amniotic fluid then travels and obstructs your pulmonary vessels and causes respiratory distress and circulatory collapse. So basically the fluid inside your belly when you're pregnant, that's going to go into your respiratory system, and it's going to actually cause a respiratory distress and circulatory collapse. And it can occur during labor or birth or within 30 minutes following birth, and this can cause some perfusion problems. It causes 5 to 10% of it causes mortality, so you can die from it. So 5 to 10% of patients can die. That's from 5 to 10% of pregnancies, deaths are from this disease. Of the patients, 50% die within the first hour of onset of symptoms. For those that survive the initial cardiorespiratory phase, 50% develop a coagulopathy. So guys, let me just say that again. So 5 to 10% of the people, that's 5 to 10% of deaths of newborns is from this. And then if you get this, you're about 50% you're gonna die. So it's called Anaphylactoid syndrome, and that's when the amniotic fluid mixes with the circulatory system. And risk factors include placenta previa or abruption, preeclampsia, eclampsia. So those are both like super hypertension, oxytocin administration, diabetes mellitus, so diabetes, cesarean birth, which is a C-section, labor induction, forceps assisted birth, so that's when the baby's not coming out and they need to use forceps, uterine rupture, cervical laceration, meconium stained amniotic fluid. Meconium is poop, so that's can mix with that, and uterine trauma. So those are all risk factors. So kind of interesting. So let's go over expected findings. So it's gonna be sudden chest pain or shortness of breath, and that's gonna indicate respiratory distress, coagulation failure, and circulatory collapse. So what are you going to do if you're in the healthcare system? You're going to want to administer oxygen 8 to 10 liters per minute. You're going to want to administer mechanical ventilation because that circulatory system is not going to be working. You're going to want to perform cardiopulmonary resuscitation if necessary. Administer IV fluids. Position the client on one side with the pelvis tilted at 30 degrees angle to displace the uterus, and you would want to administer blood products to correct coagulation failure. Insert an indwelling urinary catheter and measure hourly urine output. You're going to also want to monitor maternal and fetal status and prepare the client for emergency C-section if not delivered. So guys, this is extremely dangerous. And there's the risk factors are, high hypertension, high blood pressure, the administration of oxytocin, diabetes, C-section, forceps assisted birth, meconium stained amniotic fluid, and uterine trauma. So not something you want to have, but 50% of the people end up living. So that's not the best number, but it's just interesting to learn about these type of things. Thanks for watching.